everyone, welcome back to my channel. Today we are diving into an important topic that every USMLE aspirant and physician needs to understand: medical ethics. Ethics is not just a subject you study, it's a critical part of patient care and decision making in medicine. In today's video, I'll be sharing some thought-provoking questions related to ethics that you might encounter on the USMLE. These scenarios will not only help you prepare for the exam, but also reinforce your understanding of how to navigate complex situations in your future practice. Let's get started. Alright, now that we have set the stage, let's dive into our first ethical scenario. As we read through each question, I'll share the options and we can discuss them together. I want you to think critically about each response and consider not just the facts, but also the ethical principles at play. Let's start with the first question. A primary care physician is running behind schedule due to an unusually busy clinic day. A patient has been waiting for over 40 minutes past his appointment time. When the doctor finally enters the examination room, the patient appears frustrated. What is the most appropriate way for the physician to address the patient's concerns regarding the delay? A. You may cancel today's appointment and reschedule for a later time. Now, this response dismisses the patient's time and needs, exacerbating frustration rather than addressing it. It shows a lack of commitment to patient care. B. I'm really busy today, so let's get started. What seems to be the problem? This option minimizes the patient's experience of waiting and conveys a sense of urgency that may make the patient feel undervalued and rushed, which is not conducive to effective communication. C. I understand you've been waiting. I was caught up with the other patients. Let's try to make this quick. While it acknowledges the wait, this response suggests that the physician is more focused on time constraints rather than on the patient's concerns, undermining the quality of the interaction. D. It's not my fault that the clinic is busy. Let's focus on your issues. This option shifts blame to external circumstances, which can damage the doctor-patient relationship. It lacks empathy and fails to take responsibility for the delay. E. I apologize for the delay. I appreciate your patience. How can I assist you today? This option acknowledges the patient's frustration, expresses empathy, and invites the patient to share their concerns. It fosters a supportive environment, prioritizing the patient's needs despite the scheduling challenges. Therefore, the answer is E. Case number 2. A 52-year-old man visits his physician for a follow-up appointment regarding his diabetes management. During the visit, the physician reviews the patient's lab results and realizes a critical medication dosage was mistakenly documented incorrectly in the patient's chart during a previous appointment. The physician is concerned about the potential impact of this error on the patient's health and feels it is important to address the mistake directly. What is the most appropriate way for the physician to inform the patient about the error? A. I need to let you know that I made an error in your medication dosage during our last visit. It's not a big deal, but let's move on. This option downplays the seriousness of the error and fails to engage the patient in a discussion about the implications and corrective actions. B. I discovered a mistake in your medical records regarding a medication dosage. I want to apologize and discuss how we can correct this moving forward. This option acknowledges the mistake clearly and expresses accountability. It invites a conversation about how to correct the issue, demonstrating transparency and a commitment to patient safety. C. Don't worry, mistakes happen, but your current dosage is fine. Let's not dwell on the past. This response minimizes the importance of the error and does not provide a path for addressing the mistake, which can leave the patient feeling unsupported. D. You should have been on different dosage, but it's too late to change anything now. Just continue as we discussed. This option is dismissive and suggests a lack of concern for the patient's health and well-being. It also implies that no corrective action will be taken. E. I just realized I made an error in your chart about your medication, but it probably won't affect you much. Now, this option trivializes the error and fails to engage the patient in a meaningful discussion about its potential implications. Option B is the best choice as it prioritizes transparency, accountability, and patient engagement, which are crucial in maintaining trust and ensuring patient safety in healthcare. Case number 3. A 42-year-old physician works in a busy outpatient clinic and has developed a strong rapport with many of her patients. One day, a long-time patient who has a history of chronic illness brings the physician an expensive gift, a designer watch valued at $1,500, expressing gratitude for the care she has received over the years. What is the most appropriate initial response for the physician in this situation? A. Thank you so much for the gift. I really appreciate it and I will wear it with pride. Accepting an expensive gift can create ethical concerns and a potential conflict of interest, undermining professional boundaries. B. While I'm grateful for your kindness, I cannot accept such an expensive gift. Let's find another way to celebrate our relationship. This response acknowledges the patient's gratitude while maintaining professional boundaries. It sets a standard for ethical behavior and suggests finding an appropriate way to celebrate the relationship. C. I can't accept this watch, but I appreciate the thought behind it. Perhaps we could discuss your treatment instead. While this response is polite, it does not directly address the appropriateness of accepting gifts and may still leave room for misunderstandings. D. You don't need to give me anything. Your continued visits are thanks enough. This option, while appreciative, may come across as dismissive of the patient's gesture and does not clarify the physician's policy on gift acceptance. E. This is a wonderful gift. I will accept it, but please understand that I will not let it affect the quality of care I provide. This response is problematic as it implies acceptance of the gift while trying to assure the patient that care will remain unbiased, which does not adequately address the ethical concerns. Therefore, option B is the best choice as it balances gratitude with professionalism, maintaining ethical standards in the physician-patient relationship while acknowledging the patient's kindness. Moving on to the next case. A 67-year-old woman with advanced heart failure is admitted to the emergency department after experiencing a severe exacerbation of her symptoms. She has not completed any advanced directives. Her two adult daughters expressed to the physician that they want all possible interventions for their mother, including intensive care measures such as mechanical ventilation and aggressive resuscitation, if necessary. The patient is lethargic and unable to respond to her surroundings. What is the most appropriate initial response for the physician in this situation? A. You need to accept that your mother is very ill and may not recover from this. This response is blunt and dismissive. It fails to show empathy for the family's emotional state and does not engage in constructive dialogue. B. I understand this is a difficult time for you. Let's discuss what options are available for your mother's care. This option acknowledges the family's emotional distress and opens the door for discussion about care options. It fosters a supportive environment allowing for more informed decision-making process. C. I recommend that you reconsider the decision for aggressive interventions. Your mother's condition is critical. While this option tries to guide the family, it may come off as confrontational and could alienate them. It does not encourage an open conversation. D. Families often want to pursue every treatment, but this can sometimes lead to unnecessary suffering. This response may seem judgmental and could make the family feel their wishes are being dismissed. It lacks the empathy needed in this situation. E. Your efforts to prolong her life may be futile. She is not going to recover. This statement is too direct and lacks compassion. It can damage the physician-family relationship and does not promote a discussion about care options. Option B is the best choice as it balances empathy with a willingness to discuss care options, making it the most appropriate response in this challenging situation. Case number 5. A 42-year-old woman presents to your clinic with symptoms of anxiety and depression. She expresses a desire to manage her symptoms through herbal medicine, having read about natural remedies online. She is hesitant to use prescribed medications due to concerns about side effects and dependency. What is the best response to address her concerns and provide guidance regarding treatment? This question addresses patient autonomy, consent, and the doctor's beneficence and professional integrity. A. I understand your concerns about medications, but herbal remedies can also have side effects. Let's discuss the evidence for both options so you can make an informed decision. This response validates the patient's concerns about medications and highlights that herbal remedies also have potential risks. It promotes informed decision-making by encouraging a discussion about both options, fostering a collaborative approach to her treatment. B. Herbal medicine is not scientifically proven to be effective. You should consider taking the medications I prescribe without any hesitation. While it is true that some herbal remedies lack rigorous scientific validation, this response dismisses the patient's autonomy and preferences. It does not acknowledge her concerns and fails to provide a supportive discussion about the treatment options. C. It's great that you are looking for alternatives. Have you considered combining herbal remedies with prescribed medications to see if that works better for you? This response is supportive but may not adequately address the potential risks of combining treatments without proper guidance. It could mislead the patient into thinking that all combinations are safe without considering interactions or side effects. D. Many patients have benefited from herbal treatments. I recommend you try that first before considering any medication. This option promotes herbal treatments without discussing their evidence base or potential side effects. It may encourage the patient to prioritize an unproven method over possibly more effective evidence-based treatment, which could delay necessary care. E. Herbal medicine is just a placebo and won't help you at all. You should definitely stick to allopathic treatments because they are the only effective option. This response is dismissive and undermines the patient's concerns and interests. It does not foster a therapeutic alliance and may alienate the patient, making her less likely to trust or communicate openly about her treatment preferences. The best approach is to engage the patient in a conversation that respects her views, informs her about the evidence for both herbal and allopathic treatments, and ultimately supports shared decision making. So, option A achieves this effectively. Thank you for listening. Please do put in any suggestions or comments below if you find this helpful. Stay tuned for more. Don't forget to like, share, and subscribe.